Smells really good. Hi everyone! Thank you so much for joining my channel today. My name is Rachel Gajardo. Some of you may already know me by now, but I am an independent health insurance agent who specializes in Medicare options for seniors. I'm really excited to be presenting today's video because we are going to be talking about the donut hole. In my 5 years of experience being a licensed and certified health insurance agent, I would say that prescription drugs are probably the most nuanced part about my job. A lot of times I have clients who start taking a new medication that we didn't factor into our costs when I had seen them last year. As I had mentioned in my last video, prescription drug formularies can change on an annual basis. Just because your medication costs you this much this year, it doesn't necessarily mean that it's going to cost the same for next year. A big part about my role as an independent agent is checking all of my clients' prescriptions from year to year. And then, because I'm independent, I'm able to look at all of the plans available to them in their area and also figure out which of those plans is going to be the most cost-effective for them for the coming year. It's really important, and I can't stress this enough, how great it is to work with an independent agent like myself and make sure that you review those medications each year. What I always strive to do, of course, taking in all of my other clients' needs into consideration, is if they are afraid of hitting the donut hole, I can take a look at which plans would hopefully prevent them or at least stretch out the time that they have before they enter the donut hole to make sure that they're saving the most that they possibly can. Oftentimes people hear the donut hole and it sounds a little bit scary or daunting. If you have hit the donut hole before, you might be familiar with what this means. I'm here today to take somewhat of a complicated topic and break it down into something that's a little bit more digestible. Regardless of whether you are enrolled into a standalone prescription drug plan or a Medicare Advantage plan with prescription drug coverage, all Medicare beneficiaries have 4 different phases of drug coverage. Something to keep in mind though is that not all Medicare beneficiaries go through every single phase. Some people go through one of the phases, some people go through 2, some people go through 3, and some people make it all the way to the 4th phase. So I want everyone to think about the phases that I'm going to talk about on an annual basis, and that is a calendar year. You will have those 4 phases that are applied to you starting on January 1st of each year, and then it will extend all the way until December 31st. Once January 1st rolls again for the upcoming year, everything will be wiped clean. You start off with a brand new slate, and I'll explain how that works in just a moment. Now, the numbers that I'm going to be going over are the numbers for 2021 coverage. I will be doing these updated videos each year because these amounts can change. The first phase of drug coverage is called the deductible phase. Something important to remember though is that not every single prescription drug plan has a deductible. A lot of Medicare Advantage plans, for example, in Southern California, do not have a deductible. So for some people, you may or may not have this first step applied to you. If you don't have a deductible, you can go ahead and skip to phase number 2. But if you do have a deductible, in 2021, that deductible can be up to $445. Some standalone prescription drug plans don't have a deductible, but they have higher premiums, so that might be your case depending on your plan. Let's pretend you do have a deductible and you have 2 medications. One of those medications is $200, the other medication is $245. If you can guess, I'm using simple math. I was an English major at UCLA. I'm not very good at math, so I'm going to be using very simple numbers for the sake of this video. If you pick up those 2 prescriptions for 1 month at the pharmacy, let's say you pick them up in January, if you add those 2 together, you already hit your $445 deductible. Cha-ching! You get to move into phase number 2. On January 1st of 2021, you may not have noticed it, but you had an imaginary piggy bank that was dropped off on your doorstep. In this piggy bank, you had $4,130. Every Medicare beneficiary gets this amount individually. So I have some clients who are of course married and they each get their own piggy bank, but they do not come together into one giant piggy bank. The dollar amount that is in your piggy bank is just for you and your specific medications. Let's pretend that you pick up a prescription at a pharmacy and the retail cost of that drug is $100. Let's pretend that your copay is $5. That means that the insurance picks up the other $95. How much money do you think they take out from your piggy bank every time you get that one medication filled? If you guessed $100, you're correct. Let's say in January you get this medication filled at the pharmacy, they take out $100 from your piggy bank. That means for the rest of the year, you have $4,030 left in your piggy bank. They will do this for every single medication, every single time you get it filled at the pharmacy, the full retail cost of your drug. Let's say that you're taking 5 medications and they're all much more expensive than $100 retail. That means that you will likely run out of money in your piggy bank faster than say someone who may not be taking any medications at all. If you run out of money in your piggy bank and it's completely empty, that means that you will enter the third phase of drug coverage, which is called the coverage gap or the donut hole. The donut hole sounds a little bit scary. If this is something that you are concerned about, if you're taking very expensive medications that you pay a lot out of pocket for, I definitely feel like it's worth having me look over your medications. If you check out my website, www.rachelgajardoinsurance.com, you can schedule a no-cost consultation with me. In that consultation, I can look over your medications, I can figure out what plans are available in your area that are going to save you the most on your medication. Now, in the coverage gap or the donut hole, that's when a member typically sees their cost in prescriptions go up. You are now spending 25% of the retail cost of your drugs. Going back to our example, if the retail cost of our medication is $100, we're now paying 25% of that $100 at the pharmacy. So remember when I used to spend only $5 on my medication when I still had money in my piggy bank? I'm now paying 25% of $100 or $25 for the same exact medication. The only difference is I don't have money in my piggy bank left, so my out-of-pocket expenses are going to be greater. Keep in mind, if your prescription drug plan has coverage for certain tiers through the coverage gap, those specific tiers, more often than not, it's tier 1 and tier 2. That means that those prescriptions on those tiers will stay the same. They will not be going up in copay or percentage. The member must spend $6,550 out of their own pocket to exit the donut hole and enter the fourth and final phase of drug coverage, which is called the catastrophic coverage phase. In order to reach that $6,550 mark, the money that you spent in the previous phases can be applied to that amount. We call this the true out-of-pocket cost. It's the money that you personally spend, not what the insurance picks up. So whatever you spend out of your own pocket, that helps to add up to the true out-of-pocket cost. When you are in the catastrophic coverage phase, that's when the insurance jumps back in and says, we will help you pay for about 95% of your drug costs. If you make it to this fourth and final phase, you will stay in that phase until December 31st. The great news is, for your prescription drug plans, you have the opportunity to change those plans at least once a year. This is true regardless of whether you have a standalone prescription drug plan paired with your Medigap policy or a Medicare Advantage plan that includes prescription drug coverage. So just as a friendly recap, there are 4 phases of drug coverage. The first phase of drug coverage is called the deductible phase. Remember that not all plans have a deductible, and if your plan does have a deductible, that amount can vary, but it cannot be any more than $445. If you do have a deductible, you would need to pay the retail cost of your drugs until you spend the amount that the deductible is. Once you spend out-of-pocket retail costs, the deductible amount, if your plan has one, that's when you enter the second phase of coverage, which is the initial coverage limit. This is your piggy bank. That is the $4,130 in your piggy bank. If you run out of money in your piggy bank, that's when you enter the third phase of drug coverage called the coverage gap or the donut hole. This is when the member spends 25% out of the retail cost, regardless of whether their prescriptions are a brand name or a generic. In order to exit the donut hole, the member needs to spend the true out-of-pocket cost, which is $6,550 for 2021. This is the amount that the member spends out of his or her own pocket, and keep in mind the money that you spent in the previous phases do apply to this true out-of-pocket cost. Once you spend that $6,550 out of pocket, that's when you enter the fourth and final phase of drug coverage called the catastrophic coverage limit. This is when the member typically spends about 5% of the retail cost and the insurance company picks up the other 95%. Just a friendly reminder, some of my clients never hit the catastrophic phase. Some of my clients do not hit the donut hole. Some of my clients don't run out of money in their piggy bank. And some of my clients don't even make it past the deductible phase. Remember, it's all going to depend on your specific medications. To wrap up this video, I just wanted to say I know that this is a lot of different numbers. It can seem like a very convoluted and complex topic, but I hope that you really learned something today. Feel free to rewatch this video, connect with me, and I can help guide you over the phone as well. I'm going to go and eat this donut, and I can't wait to see you in the next video.